Let's talk about that sharp, nagging pain on the outside of your elbow. You've probably heard it called tennis elbow, right? Well, today we're going to pull back the curtain on the real story behind that pain. And you'll be surprised to find out that for most people, tennis has absolutely nothing to do with it.
Yeah, that feeling. The one that makes lifting your morning coffee feel like a workout, or makes a simple handshake unexpectedly painful. If you're nodding along right now, you are definitely not alone. But here's the thing. What if the name we all use for this is actually sending us down completely the wrong path to fixing it?
You heard that right. It's kind of crazy, but the vast majority of people dealing with so-called tennis elbow have never even stepped on a court. The real cause is way more common, and honestly, a lot less glamorous. It probably has more to do with your keyboard, your screwdriver, or your garden shears than any tennis racket. Okay, so let's start by ripping the Band-Aid off. We have got to talk about this name, because to really understand what's going on with that elbow, we first have to call it what it actually is. The proper medical term is lateral epicondylitis. Now I know that's a mouthful, so let's ignore the fancy words for a second and just focus on what it means. It's a chronic, degenerative condition. That means it's not a one-time injury. It's a slow breakdown over time, caused by doing the same motions over and over and over again. And you might be surprised by just how common this is. It affects up to 3% of everybody, usually in the arm you use most. But here's the key takeaway. It hits non-athletes just as often as athletes, and it's most common between the ages of 35 and 55. So no, this isn't some pro athlete's problem. This is an everybody problem. Okay, so if tennis isn't the main culprit, what is actually happening deep inside your arm? This is where things get really interesting, because the cause of the pain is not what most people assume. Not even close. Let's get specific. Meet the main character in this story, a little muscle in your forearm called the extensor carpi radialis brevis, or ECRB for short. Its tendon attaches right to that bony bump on the outside of your elbow. Every single time you grip something, twist your wrist, or even just stabilize your hand to type, this little guy's putting in work.
And here it is. This is probably the biggest myth we need to bust. We hear itis, and we think inflammation, we think swelling, but the science shows that's wrong. This isn't tendinitis, it's actually tendinosis. So what's the difference? It's huge. The problem isn't swelling, it's wear and tear. Your tendon isn't on fire, it's fraying like an old rope.
If you looked at the tissue under a microscope, you wouldn't find the cells that cause inflammation. Instead, you'd see tiny little micro tears in the tendon. The fibers look all messy and disorganized, and to make matters worse, this specific area doesn't get a lot of blood flow, which makes it incredibly slow to heal itself, creating this frustrating cycle of pain. So if it's a wear and tear issue, what's doing all the wearing and tearing? Well, the culprits are usually hiding in plain sight in the things we do every single day. Just take a look at this list. On one side, you have our jobs, endless hours of typing and using a mouse. Think of the twisting motions a plumber or a carpenter makes all day, or the precise tight grip of a dentist. And yeah, on the other side, you do see sports, but notice the pattern. It's all about that repetitive motion, over and over again. This right here just sums it all up perfectly. It's not one big, dramatic injury. It's the constant, low-level stress that just slowly overloads the tendon. You could call it death by 1,000 paper cuts, or maybe more accurately, death by 1,000 mouse clicks. Okay, enough of the bad news about what's going wrong. Let's talk about how to make it right. Because the really good news is that there's a very clear, proven playbook for recovery, and it works for most people. The first line of defense is what we call conservative treatment. Step one, and this sounds easy, but it's often the hardest, is rest and changing the activities that are causing the problem in the first place. You can use ice and basic pain meds to manage the symptoms, but the real game changer, that's step three, physiotherapy. Specific exercises to strengthen the tendon and make it more resilient are absolutely key. And here is the number I really want you to see. This simple, non-surgical approach, it works. How well? For a whopping 80 to 90% of people. That's incredible. The condition is very, very treatable. It just requires a little bit of patience and commitment to the plan. Now, what about that other 10 or 20%? Well, for those really stubborn cases, and we're talking after a good 6 to 12 months of trying everything else, then more invasive options like injections or even surgery might get discussed. But I have to be clear, that is not the starting point. So, you followed the playbook, you're feeling a whole lot better. Awesome. Now, how do we make sure you never have to deal with this again?
Let's talk about future-proofing your elbow.
Prevention really just boils down to being a little smarter about how we use our bodies. It means warming up properly. It means using the correct form, whether you're at the gym or at your desk. Building up that forearm strength is huge. And don't forget your environment. Simple ergonomic tweaks and, most importantly, taking regular breaks from those repetitive tasks can make all the difference in the world.
So, at the end of the day, tennis elbow isn't really about tennis, and it's not about inflammation. It's a classic wear and tear injury, a direct result of the demands of our modern lives. That little ache you feel, that's not just pain. It's a signal. It's your body telling you that a part of it has been pushed too far. So the only real question left is, are you listening to the whisper before it becomes a scream?